Treatment of infertility when you have a cold uterus. In this video today, I welcome you, my friend. We are going to answer a question that was asked by one of our viewers to talk about treatment of infertility when a woman has a cold uterus. Do you know what a cold uterus means? Do you know what a warm uterus means? In this video today, we are going to talk about all this. So watch this video up to the end because the information is very, very important. If you have tried to get pregnant and you are actually not getting pregnant, your doctor has told you you have what we call unexplained infertility. Unexplained infertility is when actually all the tests you've done, they are showing that you are very normal. You are trying to get pregnant, but things are not working out, and you actually have a cold uterus, but you didn't know that you have a cold uterus. Watch this video and we are going to talk about all this. Gerard Massa, the health educator, is the name of the channel. I welcome you to our channel, Gerard Massa, the health educator. And on this channel, we do talk about fertility. We answer all your questions. Just like one of our viewers asked this question, you can also comment below your question. Whatever you've always wanted to know about why you are not getting pregnant, ask your questions down below and I could actually make the next video answering your question, just like I'm doing this for one of our viewers. She's called Kamela Moketezuma. So we are answering this question, and without further ado, we shall begin by first of all understanding what a menstrual cycle is, and then from there we shall be able to answer this question very well, because to know that you have a cold uterus is specifically you need to first of all understand your menstrual cycle, because the menstrual cycle is divided into two phases. We have the first half, or the first 2 weeks, when you have seen your periods today, then let's say this week, then the next week. The first 2 weeks of your menstrual cycle are what we call the follicular phase, and then the next following 2 weeks of your menstrual cycle are what we call the luteal phase. Mu video yaffe ya leero tuli kwogera ku nsonga oba ekibuuzo ekibuuziddwa one of our viewers, Kamela Moketezuma, atubuuzizza n'agamba nti twogereko ku nsonga ey'okubanga omukyala agezezaako okufuna olubuto naye ate n'abanga tasobodde kubanga afuna olubuto, ate nga ekizuuliddwa kiri nti yandibanga alina nabaana ennyogoga. Mu video eno leero tugenda kwogera ku nabaana ebeera etya nga ennyogoga. Osobola otya okuba ng'olemerera okufuna olubuto, ogezezaako okufuna olubuto nga biganye, kumbe ng'olina nabaana ennyogoga. This video is going to be in two languages, in English and in Luganda. So without further ado, we are proceeding. We said that the first 2 weeks of your menstrual cycle are what we call the follicular phase, and then the next 2 weeks, or the second half of your menstrual cycle, is what we call the luteal phase. Week ezisooka ebbiri eza menstrual cycle yo zezo ze tuyita follicular phase, ate week eziddako zezo ze tuyita luteal phase. Okumanya nti wandibanga olina nabaana ennyogoga, omanya otya nti olina nabaana ennyogoga? Omanya nti olina nabaana ennyogoga ng'ogezezaako okufuna olubuto, bakuwadde eddagala lyonna lyonna ery'ekizungu naye nga biganye, then awo wandibanga olina nabaana ennyogoga, era video eno tuli kwogera ku eyo ensonga. So we are proceeding with our question, we are proceeding with our video lesson for today. And remember, you can actually ask me all your questions down below in the comments. Anything you are not understanding, or any tips or any additions you would like us to add in, please comment below this video. We are proceeding with our video lesson for today. How can you get pregnant? How can you treat a cold uterus so that you get pregnant faster? We have said that the first phase of the menstrual cycle is known as the follicular phase. This is when your follicles are growing. This is when your eggs are growing. The key is here. For you to know that you have a cold uterus, normally you are going to be having cold hands, cold feet, and then also your doctor will tell you that you have what we call unexplained infertility. So when you have unexplained infertility, there could be an issue. There could be changes taking place. What is happening is this: if at all the saturation to your womb is actually insufficient, or you have a condition known as blood stagnation, and then also if the levels of progesterone hormone being produced are very low, then you are most likely going to be having what we call a cold uterus. Now, when we talk about progesterone, what do we mean? Tugambye nti wobanga obadde ogezezaako okubanga ofuna olubuto naye nga biganye, ate nga dokita wakugambye nti wandibanga olina obuzibu, kyetaaga n'okimanya nti menstrual cycle yo erimu weeks 4, waliwo week ezisooka 2 ze tuyita follicular phase, then week eziddako ze tuyita luteal phase. Omukyala alina nabaana enyogoga, ebiseera ebisinga agenda kuba nga alina emikono nga ginyogoga, emikono gyo ojja kuba buli kiseera owulira nga ginyogoga, n'amagulu go ojja kuba owulira nga ganyogoga. There are many causes of a cold uterus, but the commonest causes of a cold uterus is when a woman consumes foods or types of foods which are really so cold. For example, if you are a couple, you are a woman, you are trying to get pregnant, but you always eat food which is very cold, you take lots of cold beverages, there are high chances that these can actually connect and lead to what we call a cold uterus. So this actually treatment of a cold uterus and warm uteruses and then all that, this is basically a branch of medicine known as complementary medicine. We are talking about Chinese medicine here. So we have said that in China, normally treatment has been taking place for cold uterus for ages. What is happening is that for you to get pregnant faster, if at all you have been told that you have unexplained infertility, you need to work on your womb. Actually, you need to work on your cold uterus. How can you identify that you could be having a cold uterus? It is very simple. When we go back to our videos we've done about ovulation, during ovulation, one of the signs to show that you have undergone ovulation is that there's going to be a rise in your body temperature, also known as a rise in your basal body temperature. So when the body temperature has risen a bit, then this could actually mean that you have ovulated. But in women who have cold uteruses, then the rise in the body temperature is not going to take place. Actually, during ovulation, even after ovulation, you remain cold. You remain actually feeling cold. The whole of your body is cold. You take temperature with your thermometer, still it gives you readings which are very low. Then it is high time you thought about treatment of your cold uterus. Tugambye nti omanya otya nti wandibanga olina nabaana enyogoga mu biseera bye tuyita ovulation oba mu kiseera egi we livaayo okubanga libeera released. Ebiseera ebisinga ng'ojja kusigala ng'oli munyogovu kuba kimanyiddwa nti during ovulation omukyala wabanga badde ayise mwene embeera eyo ovulation ng'egirivuddeyo okusisinkana amazzi g'omusajja agenda kubanga kwegamba awuliramuko ka temperature nga karisinze, naye omukyala alina cold uterus. Ebiseera ebisinga ojja kulaba nti nabaanayo ebeera esigala ekyali nyogovu, ate n'ekirala nawe kenyini ojja kubanga kwegamba owulira omubiri gwo nga guli cold, buli wamu wajja kubanga kwegamba engalo n'amagulu ojja kulira nga olina cold hands and cold feet. We are proceeding with our video today. We are talking about complementary medicine. We are answering a question asked by one of our viewers, Kamela Moktezuma. I hope it's a correct pronunciation, Kamela. So thank you for asking this question and thank you for supporting our channel. Thank you for watching our videos and for recommending our videos to all your friends. I'm really so happy to have you as my friend. Remember, ask me all your questions and I will answer them here in regards to fertility, issues of getting pregnant faster and how best women can get pregnant faster. If you have tried to get pregnant and things have not really been so easy, then watch all our videos on this channel. put in prayers, and then also follow what your doctors tell you, things will work out. So we are saying that in a nutshell, a cold uterus normally happens when a woman has low progesterone or insufficient release of progesterone from the corpus luteum. The corpus luteum is specifically that empty shell where the egg was released from. Remember, we've talked about ovulation in many of our videos on this channel, and we have said that during ovulation, there's a release of a mature egg. So where that egg has been released from, what remains behind is actually known as the corpus luteum. It is supposed to disintegrate or disappear, but before it disappears, it plays a key role in actually regulating your temperature and then also in releasing progesterone. And remember, progesterone is the hormone which is going to keep our baby so that the baby grows up to the recommended 40 weeks or 38 weeks. So tugambye nti omukyala abadde alina obuzibu ne hormone gye bayita progesterone nga ebadde eri insufficient, oba omukyala alina obuzibu ne blood flow to the uterus, ebiseera ebisinga ojja kulaba nti ajja kuba n'abaana ng'ennyogoga nnyo. Tosobola kimanya nti olina n'abaana ennyogoga, teri test esobola kulaga nti olina n'abaana ennyogoga. Jjukira treatment gye twogerako yeno treatment gye tuyita Chinese medicine oba enzijanjaba ey'ekichina. Ojja kulaba nti ate ebiseera ebisinga woba olina embeera eno era weetaaga omukugu alina obukugu mu eyo embeera asobola okuba nga akujjanjaba. So we are proceeding with our video lesson. Remember, you can schedule a private consultation with me, and you can actually connect with me on my WhatsApp, but you first book through my website because all my clients are booking through the website. You book through the website, and then we shall be able to schedule appropriate time for you, and then we shall talk more, answer all your questions, and I will give you my best recommendations on how you can get pregnant faster, because there are lots of couples we have worked on and they are really happy. They are giving testimonies. So we are proceeding and we are saying that the treatment of a cold uterus is very simple. You specifically have to work on your environment. You have to look at simple things like putting on your socks whenever it is cold. Then the other thing is you should look at least opting more for warm cooked foods. Avoid eating food which is very cold. Eat food which is actually warm, and then keep yourself warm. More so if you are in the category of a TTC mother. If you are in the category of a mother trying to get pregnant, you are a woman trying to get pregnant, please make sure that you keep yourself warm. What you should take from today's video is this: for a woman to get pregnant faster, there should be a sufficient production of progesterone in your womb. Actually, your corpus luteum, you should be having enough progesterone. And we have said that progesterone is the pregnancy hormone. But if at all, every time you are eating cold things, you are keeping yourself actually cold, and you are trying to get pregnant, sometimes your doctor might tell you that you have unexplained infertility when it is something to do with the temperature of your womb. And then the next thing is, if you are trying to get pregnant, then make sure that you work on your temperature. Make sure that you actually, we've talked about keeping yourself warm, but make sure that you do simple exercises. Do not over-exercise. Make sure that you do simple exercises like walking, swimming, to have sufficient blood flow through your cardiovascular system. Obogezaako okubanga oyagala okufuna olubuto, kyolina okutwala mu video eno kiri nti gezaako okulaba nga at least keeping obere warm, tokkiriza mpewo okubanga ekuyitamu nnyo, ate n'ekirala making sure nti hormone zo zibalansinga, progesterone ebeere ng'emala mu mubiri gwo. Progesterone ye hormone ezimu eziyambako olubuto ejja okubanga we liba lyekutte ku kisenge ky'abaana ne liba nga ligenda kuba likula paka ku myezi 9. Woba olina progesterone nga ntini, then ebyokufuna olubuto biba bisobola okubanga bizibu. Zo abamu bafuna mangu embuto, naye mulimu percentage ey'abakyala abajja okwetaaga assistance oba support ey'omukugu. There's a percentage of women who will get pregnant faster, even on their own, even without medical support or without consulting any experts. But for those percentage, or for those few who actually need support or assistance, then you should watch these videos on our channel. Watch also videos on other channels on YouTube, and then of course elsewhere, as long as they are experts and they know what they are talking about. Watch all those videos and then follow the advice. Put your trust in God. Everything can work out. There's lots of more videos for you on this channel. Make sure that you go through all our videos if you are looking at getting pregnant. Schedule a private consultation with me and we shall talk more. I'll give you my best recommendations. Thank you, Kamela Mokitezuma, for asking me this question. I hope I answered it well. If at all you have any additions you would like me to add, please comment below this video. I will talk to you. Thank you, my friend, and yes, remember to come back tomorrow for our next video about fertility and how best you can get pregnant. Talk to me today and I will answer all your questions. Webale nnyo mukwano gwange okubuuza ekibuuzo kino. Kamela Mokitezuma, nsanyuse nnyo era jjukira nti naawe mukwano gwange nsobola okuddamu ekibuuzo kyo, nsobola okukola ekibuuzo kyo ne nkifuulamu video ne nkiddamu in form of video so that abalala bangi nnyo nabo ne baba nga babenefitinga ne baba nga bafunamu. So connecting nange ku WhatsApp yange eri wano wansi wa video eno. WhatsApp eri +256 70 affect your pregnancy. Will a fibroid affect your pregnancy? Many times this question has been asked, that what are fibroids and how do fibroids affect your pregnancy? If you've been asking yourself what fibroids are and how they can affect your chances of getting pregnant, and even if you are pregnant, how they are going to affect your pregnancy, then this video is for you. Massa, the health educator, is the name of the channel, and without further ado, we are going to talk about fibroids and pregnancy. What are fibroids? Fibroids specifically are smooth muscle tumors. Also, they are commonly known as leiomyomas. Leo means smooth, and then myo means muscle, and then oma, it actually means a tumor. So a fibroid is a smooth muscle tumor. Kiki ekiba kitegeezebwa obanga obadde oli kwebuuza nti fibroids kyeki, okoze scan, dokita wo akugambye nti olina ekirwadde kye bayita fibroids oba olina ebizimba. Mu vidiyo eno leero tugenda kwogera ku fibroids, tugenda kwogera ku bizimba. When you have done an ultrasound scan and the results have come out and they are showing that you have fibroids, then this simply means that your womb is having swellings or it is having masses which have been seen on an ultrasound scan. What brings about fibroids? Wobanga okoze scan ate nebanga ekulaga nti olina ebizimba, then ate dokita wonabanga akugambye nti olina ekizimba kye bayita fibroid. Tujja kuba twogera ku biki ebireeta ebizimba ebiyitibwa fibroid. So the first thing we need to understand is that according to the NIH, fibroids actually do not have a one specific cause, but there are other factors which are known to be contributing to the development and the growth of fibroids. These include high estrogen levels, very common in women who have taken time without getting pregnant, or they gave birth but they've taken a long time to give birth to the second born or to the third born. So failure to get pregnant or taking long to get pregnant leads to accumulation of a hormone known as estrogen, which actually may bring about growth of these masses or fibroids. It can actually also bring about endometrial hyperplasia or thickening of the inside of your womb. Obanga obadde weebuuza nti biki ebisobola okuba nga bireeta ebirwadde bino oba ekizimba, then ojja kuba otegeezebwa nti okunoonyereza kungi kukoleddwa naye ate ne kuzuulibwa nti ebizimba bino ebiseera ebisinga bijja lwa hormone gye bayita estrogen ebeera ennyingi ennyo. Hormone eno ebaako kyeplayinga oba eyambako nnyo abakyala abagala okuba nga bafuna embuto, ate n'ekirala eyambako n'okuba nti kwegamba etegeka n'abaanayo n'oba nga osobola mangu okufuna olubuto. Naye ate oba oluddewo okuba nga ofuna olubuto, then hormone eno gye bayita estrogen ereetera n'abaana okuba nga yo ekolawo ekintu kyayo ekiringa kidole, kwegamba ne kiba nga yo n'abaana ekitwala nti kati ono ye omwana. So hormone eno ereetera mugaso gwayo gwa ku making sure nti n'abaana ebeeramu omwana, ate nebanga kwegamba omukyala asobola okufuna olubuto. Bw'aba aluddewo okufuna olubuto oba nga alina ebizibu ebya fertility, then hormone eno ereeta okuba nti n'abaana eteekawo ekintu ekyefaananyiriza omwana naye nga kiba kizimba. In this video today, we are talking about fibroids and pregnancy. How fibroids affect your pregnancy, or how fibroids can harm your pregnancy. In this video, we are talking about all this. When you do an ultrasound scan, what will show on the ultrasound image, or what your doctor will see, will be a large mass. We can say that a fibroid is big or it is very large when it is above 5 centimeters or when it is above 50 millimeters. Tuba tugamba nti woba okoze scan, dokita wo n'akugamba nti olina ekizimba ekinene ennyo, then kiba kisuukako 5 centimeters oba 5 millimeters. 5 centimeters oba 50 millimeters. Ekizimba kyonna ekiri waggulu wa ebipimo ebya 5 centimeters tuba tugamba nti kinene nnyo. Ekizimba ekiri wansi wa 5 centimeters, below 5 centimeters, kiba kikyali kitini naye ate kiba kisobola okweyongera okuba nga kikula. We've said that fibroids that show on your ultrasound scan and they are above 5 centimeters, then we say they are very big. But if at all they are below 5 centimeters, then we say they are relatively small. But remember, if they are not managed, then they can still grow and even increase in size. After doing your scan and then you have seen that you have a fibroid, before getting pregnant, it's always advisable that you see your doctor who will give you the best treatment options. Remember, this video is for education and information purposes only, so treatment of fibroids specifically will depend on whether you are already pregnant or you are planning on getting pregnant or you are not yet pregnant. Treatment is much more easier if you are not yet pregnant. But before we go to the treatment of fibroids, it is very key for us to talk about the different types of fibroids. We have those known as the subserosal fibroids, and then we have those known as the submucosal fibroids, which are located inside. The subserosal are located outside, and then we also do have the pendiculated types of fibroids, which are located outside, and actually they act or they show as if they are attachments to your womb. How do fibroids appear on ultrasound scan? Ebizimba bino obanga okoze scan, tuli kwogera ku types eza fibroids. Tugambye nti waliwo type gye bayita submucosal ebeera muli munda munabana mwennyini, and then waliwo gye bayita subserosal ebeera wabweru, and then waliwo gye bayita pendiculated ebeera wabweru naye ate kabanga akantu akekutte ku nabaanayo. So tugambye nti ebizimba bino oba omaze okuba nga okola scan n'oba nga ofuna ate okuba nti ofuna obujjanjabi, basobola okukola operation oba tonafuna lubuto, bagiyita myomectomy. We have said that the treatment of fibroids is normally done in hospital, whereby they can put you, your doctor can put you on medications. Your doctor can put you through procedures in theater known as a myomectomy, where it's an operation whereby part of your myometrium or part of that area where the mass is will be excised, or it will be actually operated on, and then the fibroid will be removed, taking care not to damage the rest of your uterus. But still, there are other treatments whereby an IUD or a special intrauterine device which is hormonal based, containing progestin only, containing only progestin will be given, or it will be inserted. It is known that this IUD or the progestin only IUD, hormonal IUD, can actually increase your levels of progesterone, and increasing levels of progesterone hormone actually has what we call a counter effect on the estrogen. So one of the treatments of fibroids, if at all they are below 5 centimeters, you can actually be given this by your doctor. Remember, it's your doctor to do the treatment and the prescribing. Do not self-medicate. There's this special IUD, which is a hormone-only progestin IUD, which will be inserted. It will increase your progesterone. It will increase your progesterone hormonal levels. Increasing progesterone has an effect on estrogen. Increasing progesterone brings about the lowering of estrogen. Remember, we said in the beginning that fibroids are normally due to high estrogen levels in your system. So when estrogen comes down, if the fibroid is still small, below 5 centimeters, there are high chances that the fibroid can actually go down because of the increasing or the decreasing levels of estrogen. Tugambye nti enzijanjaba ey'ebizimba mu ddwaliro ya njawulo nnyingi nnyo, naye ate dokita wo asobola okuteekako ka IUD oba akaweta ke bateeka wansi, naye ng'ate tekabanga buno obuweta obulala obwetukozesa obwa Copati IUD, buno obuziza pregnancy. Kano ko kaba hormone based, kabeerako hormone gye bayita progestin hormone, ate progestin eno eba esobola okuyambako okulaba nga ate ekoona estrogen oba ekendeza estrogen mu mubiri gwo, kuba tugambye nti ebizimba bino bijja lwakuba nti kwegamba oba olina hormone eya estrogen nga nyingi nnyo. So woba nga ofunye treatment ate n'oba nga ebizimba bino bikyaganye okuba nga ate bivaawo, then dokita wo asobola okuteeka ku surgery ne baba nga babijjamu oba nga bakola surgery gye bayita myomectomy. Thank you, my friend. We are proceeding with today's video lesson and we are talking about fibroids and pregnancy. Having talked about the different types of fibroids, we've talked about how it presents, and then we've said that yes. Hello, my friend. I welcome you for today's video lesson. We are talking about a paratubal or a para-ovarian cystic mass. You have done the ultrasound scan and the results are showing that you have what we call a tubal ovarian cystic mass. What is a tubal ovarian cystic mass? Your doctor has told you that you have a mass, you have a cyst between your ovaries and between your fallopian tubes. In this video, we are going to discuss all this. We shall also give you some pregnancy tips and how you can get pregnant faster. Naturally. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend, and if it's your first time, remember to subscribe so that you do not miss videos we release every day about fertility and reproductive health. On this channel, we create awareness about fertility and reproductive health. We are talking about a tubal ovarian cystic mass. What is a tubal ovarian cystic mass? When we look at the name, tubal ovarian cystic mass, tubal means your fallopian tubes, and then ovarian specifically comes from the word your ovary. So a tubal ovarian cystic mass is a mass which is between your ovaries and your tubes. But specifically, there are three major types of masses or swellings which are found in the reproductive system of women. The first is what we call a myoma, which is a mass filled with muscular tissue. Myo means muscle. And then we have also masses known as fibroids. And fibroids are specifically swellings or masses which are filled with fibrous tissue, and that's why we get the word fibroid from the word fibrous. But in this video today, we are talking about a tubal ovarian cystic mass. How does it appear? How does your doctor know that this is a tubal ovarian cystic mass? When we take a closer look at your ovaries, as you can see in this picture here, the ovary is specifically that organ which is responsible for producing the eggs or releasing your eggs on every 14th day of the month during a process known as ovulation. So what if you have your ovaries? They are normal, they are having the follicles or they are releasing the eggs. You are seeing your periods every month, but at the end of it all of a sudden, you begin feeling sharp pain in your side, either on the left side or on the right side. Then it is high time, my friend, you go to hospital and have some checkups done. The checkups we are talking about include a pelvic ultrasound scan. Mu video eno leero tuli kwogera ku ebizimba, twogera ku bizimba, tuli kwogera ku bizimba bye bayita tubal ovarian cystic mass. This video is going to be in Luganda and in English. So we tuba twogera ku bizimba ebitawanya abakyala, ojja kulaba nti ebizimba bino bya mirundi esatu. Waliwo ekizimba ekisooka kye bayita fibroid, ekizimba ekyokubiri kye kino kye bayita myoma, then ekizimba ekyokusatu kye kino kye bayita cyst. We are talking about these three types of, we are talking about the cysts, and we are saying that the tubal ovarian cystic mass specifically can be identified on ultrasound scan, and we have said that when you take a closer look at how a cyst appears, normally it has a thin wall, and then it is also filled with free fluid, or it is filled with fluid, and it is actually, when you look at it on ultrasound, when you take a closer look at the ultrasound image, it's normally very black. Tuli kwogera ku bizimba era tuligamba nti ekizimba kye bayita cyst oba tubal ovarian cystic mass, ekizimba ekyo kisangibwa between oba kisangibwa mu makati ga ejjiryo lye bayita ovary n'enseke ze bayita fallopian tubes. Era tugambye nti kino ekizimba oba ng'okyetegereza ku kafaananyi ako akabeera ku kifaananyi kya ultrasound oba ku bbaluwa ye eya scan oba ka TV, oba otunudde kafaananyi ako akabeerako, ojja kulaba nti ekizimba ekyo kiba kya black, kibeeramu kwegamba kiba kya round naye ate kibeeramu ebintu ebya black. Ebintu ebya black ebyo ge mazzi oba ge tuyita free fluid. Let me know if you have any questions down below in the comments. Below this video, I will answer all your questions. Gerard Massa, the health educator, is the name of the channel, and we are talking about the tubal ovarian cystic masses. How can you manage these tubal ovarian cystic masses? Ojjanjaba otya ebizimba bino katugeze oba ozuuliddwa nti olina ekizimba kye bayita cyst. The treatment of tubal ovarian cystic masses specifically begins with doing some tests, doing some investigations. Okujjanjaba okw'ebizimba kirungi nnyo n'oba nga at least doctor wo asooka n'akola ku tests okuzuula ebizimba bino byajja bitya. Most of these tubal ovarian cystic masses, or most of these cystic masses which attack the ovaries or which grow in the ovaries specifically, they tend to resolve by themselves. They can disintegrate. Those which can disintegrate or disappear on their own, even without treatment, are known as the corpus luteal cysts. Ebizimba bino byo byennyini bisobola okuba nga bibula ate n'oba tofunye bujjanjabi. Katugeze bino ebizimba bye bayita corpus luteal cysts bisobola okuba nga byo byennyini bibula. So oba nga obadde okebeddwa naye ebbaluwa yo neeraga nti olina ekizimba kye bayita the corpus luteum cyst oba corpus luteal cyst, then oba tolina kweraliikirira ebiba bigenda kuba bibula. Ne oba olina olubuto era olubuto lusobola okukula obulungi naye ng'ate akazimba ako ne kaba nga kasaanuuka ne kaba nga kasaanaawo kwokka. What if you have the tubal ovarian cystic mass and it does not disappear on its own, it does not disintegrate? Then you need to do some more tests you need to do a laboratory test for your hormones. You need to look at how your follicle stimulating hormone is, how your estrogen levels are, and then also you need to do what we call the AMH test or the anti-Mullerian hormone levels. We've talked about the anti-Mullerian hormone levels. If you missed that video, after this video, please kindly check in our video library. There's a video on the anti-Mullerian hormone. Tugambye nti obanga ozuuliddwa nti obadde olina kino ekizimba naye ate ne kiba nga tekisobodde kubanga kibula kyokka, then olina okumakinga sure nti okola test eya hormones oba kye bayita the anti-Mullerian hormone level test and the follicle stimulating hormone test oba FSH test. testis neza hormone ziba zituyambako okulaba kyandibanga ebizimba bino biri kujja olw'okubanga hormones zo zibadde tezibalansinga. Remember, for these cysts to grow, you actually have to realize the fact that these cysts actually can grow from some specific areas, for example, where the Mullerian ducts are, oba ebitundu ebivaamu oluseke lwe bayita the Mullerian ducts. So when you do the AMH level test, or when you check your anti-Mullerian hormonal levels and you discover that it is actually higher than 4, because the normal is supposed to be 1 up to 4. If your results of the anti-Mullerian hormone levels come out and they are higher than 4, then it means you are at high risk of developing a condition known as polycystic ovarian disease. It could be that you are having a single tubal ovarian cystic mass, but when your AMH levels are high, then there are high chances that you could develop that. And specifically, there are medications which will be prescribed to you by your doctor to stabilize your hormones. Obanga obadde ozuuliddwa nti obadde olina results zino ate nga ziraze nti hormones zo tezibalansinga, oba okoze test ya AMH ne results nezifuluma ne doctor onakugamba nti results za AMH ziri waggulu nnyo, then eddagala weeri erisobola okuba nga likuweebwa ate n'obanga hormones zo zistabilizinga, bino ebizimba ne biba nga bisaanuuka oba nga bisaanawo byokka. Tubal ovarian masses or tubal ovarian cystic masses normally can resolve with medication, but if at all they do not resolve and they are higher, they are actually around 100 millimeters and above, or they are so big in size, then your doctor or your specialist can opt for surgery, where they will be removed in theater. Ebizimba bino bibanga bibadde byeyongedde okubanga binene nnyo ate biri kuleetera obulumi nga bungi nnyo, then doctor wo asobola okusalawo n'abanga akutwala mu theater ne babanga bakuoperatinga ne babijjamu ebizimba ebyo. Kitwale nti g'amazima gennyini osobola okuba nga otereera, naye the most important thing olina okumakinga sure nti okola test oba olina okuba nga okola scan. I thank you, my friend, for attending today's video lesson. I hope you've picked something about tubal ovarian cystic masses. We have said that these tubal ovarian cystic masses normally are those masses which are filled with fluid, but still they grow between your ovaries and your tubes. They could actually even be localized next to your ovary. The most important way to note these ovaries, to note these cysts, is by doing a pelvic ultrasound scan, which will confirm presence of these masses, and then also measurement will be taken. Tests on your hormones, for example, the test for FSH and AMH can be taken. If the levels show that you are having high FSH levels, then there are specific drugs which may be given. Your doctor or your specialist will be the one to decide. Do not self-medicate. This video is basically for information purposes to make you aware of how your system is. We create awareness about fertility and reproductive health. But my friend, one thing you have to note is that you can get treatment and you can get better even if you have been told that you have the tubal ovarian cystic masses. You can be treated. There are specific drugs, for example, the gonadotropins, which will be prescribed to you by your doctor. And yes, when you take these according to your doctor's instruction, you can actually get rid of these cysts, and then also you can get pregnant. Remember, these cysts do not prevent you from getting pregnant. The only issue is that please have yourself checked before you go ahead and get pregnant. Just have a routine pelvic ultrasound scan. You'll be able to see how your system is before you conceive. I welcome you to our channel. Remember to subscribe for new videos we release every day. Nkusanyuse nnyo mukwano gwange okuwuliza ku channel yaffe, era ndowooza olina ky'oyizeemu mu video yaffe ya leero. Tubadde twogera ku bizimba bye bayita para-ovarian cystic masses oba tubal ovarian cystic masses. Tugambye nti ebizimba bino bitera nnyo okujja byokka nga obadde olina issues oba hormones zo tezibalansinga, era ne tugamba nti obanga ozuuliddwa nti obadde olina obuzibu buno osobola okufuna treatment n'oba bulungi nnyo. Bwe biba nga binene nnyo basobola okutwala mu theater ne bakooperatinga n'obanga osobola okufuna olubuto. Subscribinga obeere ng'olaba video zaffe buli kanaku. Omukama tukuume. Bye bye. May God bless us all. Have yourself a fantastic and healthy day. Bye bye. The anti-Mullerian hormone, AMH. What is the anti-Mullerian hormone? Have you done the fertility test and your report has come out and the results are showing your AMH levels being low or being normal, or your anti-Mullerian hormone AMH levels are very high? Fertility testing. In this video today, we are going to learn about a fertility test, also known as an AMH levels, or an anti-Mullerian hormone test. So stay with me. We are talking about the anti-Mullerian hormone in this video. Without further ado, we shall begin straight away and talk about what is an anti-Mullerian hormone. After this short break, we are going to talk about all this. After this short break, don't leave. Thank you, my friend, for staying around. We are talking about the anti-Mullerian hormone, and specifically the anti-Mullerian hormone, or the AMH fertility test, is a test which is very key in determining what could be causing your fertility, your infertility. So, without further ado, we are talking about the anti-Mullerian hormone. The anti-Mullerian hormone is a hormone which is produced by your follicles. Specifically, when we take a look at an ovary specifically is having what we call the follicles. The follicles are those reserves which store your eggs. So, whenever your eggs are growing, whenever they are in the early stages of growth, they are going to release a hormone. This hormone is known as the anti-Mullerian hormone. The anti-Mullerian hormone can be measured using your blood test. When your doctor wants to determine how your ovaries are, how your fertility state is, then your doctor is going to request for a test on your anti-Mullerian hormone levels. The normal anti-Mullerian hormone levels are between 1 up to 4 Ng per mil. So if your report comes out and you have an AMH level of at least 1 or 2 or 3, then it means you are having normal AMH levels. But if your report comes out and you have 0.2, then it means your anti-Mullerian hormone levels are very low, and then there are high chances that you could be having also very low ovarian reserves. What do we mean by very low ovarian reserves? Specifically, the ovarian reserves are the ovaries. That's where the eggs are. So if you are trying to get pregnant and you are having issues getting pregnant, then it is high time you do the AMH level test. It's very important that you do an anti-Mullerian hormone levels. It can show how your ovaries are. It can show how your follicles are. If at all the report shows that your levels are very low, then your doctor may induce ovulation, may give you drugs to stimulate ovulation, for example, Clomid or Letrozole. So it is very, very important. If you are a couple and you have tried to get pregnant, you've tried to get pregnant but things are not working out, it is high time you do the AMH test. Thank you, my friend. We are talking about the AMH test, and Gerard Massa, the health educator, is the name of the channel. I welcome you to our channel. If it's your first time on our channel, remember to subscribe so that you do not miss new videos we talk about every day. We talk about fertility, the ovulation calendar, and we do create awareness about fertility and reproductive health. Anti-Mullerian hormone is our topic for today, and in a nutshell, we've said that this is a fertility test which is used to measure your ovarian reserves. In simple terms, it is a test which is used to determine how your ovaries are, how your eggs are. So if at all the results come out and they are very high, then it means if you actually have a report or you have an AMH level of at least maybe 5. We said normal is between 1 up to 4. If the results come out and you have an AMH level of 5 or 6, then it means there are high chances that you could be having what we call polycystic ovarian syndrome or polycystic ovarian disease. How can you confirm that you have polycystic ovarian disease? Your doctor will do a pelvic ultrasound scan, which will specifically look at your ovaries, and whenever you have small fluid-filled swellings known as cysts, and they are at least 9 and above, maybe you have 15 or 20, then you could be having a condition which is called polycystic ovarian disease. So in this video, we've talked about anti-Mullerian hormone, and it is a very important test for all couples trying to get pregnant. It can show whether you have issues like polycystic ovarian disease or you have low ovarian reserves. Remember, we said that low AMH levels directly signify how your ovaries are. When you have normal AMH readings, then it means your fertility is okay. If you have very low AMH levels, then it means you could be having issues with your ovaries. They are very low. You may need stimulation. This can be done by your doctor. This video is for education and information purposes only. Welcome to our channel. See you in my next video. Gerard Massa, the health educator, and have yourself a fantastic and healthy day. Bye-bye. Why are you not seeing your periods after a miscarriage? You have had a miscarriage and you are not seeing your periods. Why are you not able to see your periods after a miscarriage? I welcome you, my friend, for today's lesson. One of our viewers asked a question and she said, why is she not seeing her periods after her miscarriage? It's coming to 2 months. She is not able to see her periods. We are answering this question. Watch up to the end because there are lots of tips for you to answer this question. So without further ado, we shall first of all talk about what a miscarriage is. When we are talking about a miscarriage, specifically, this is a pregnancy loss at least before the pregnancy makes 20 weeks. So if you are pregnant and before the pregnancy goes to 20 weeks, there happens to be a pregnancy loss or you lose the pregnancy, actually we call this a miscarriage. So why are you not seeing your periods even after you've had the miscarriage? Even after losing the pregnancy, why are you not able to see your periods? First of all, I welcome you on our channel. Gerard Massa, the health educator, is the name of the channel. On this channel, we do talk about fertility, we talk about pregnancy tips, we do give you advice on how you can get pregnant faster, on how you can become fertile and get pregnant faster. And then also, we do give all pregnancy tips, anything related to women health. I welcome you, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. So without further ado, I'll first of all talk about a miscarriage. A miscarriage is a serious condition. When it happens, the first thing is the couple needs to go through a process of healing, both emotionally, psychologically, and then also physically. So if a miscarriage has happened, it's always good to realize that there could have been a problem. There could have been a cause of this miscarriage to happen. You do not need to put the guilt on either of the partner. You should not take up the guilt, because when you become guilty and then you begin putting it on yourself, if you did not induce it yourself, then it may actually put you in depression, and it may affect you psychologically, emotionally, and all areas. So allow yourself time to heal. Allow yourself to go through all the healing process. Follow the advice of the experts, and remember, you can get pregnant again even if you've had a miscarriage today or you've had a miscarriage at any time. You can still get pregnant. The only thing you need to do is you need to get the advice of the experts and then follow that advice, put in prayers. You can get pregnant faster. You need to put God first. So without further ado, we are going to answer the question that was asked by one of our viewers, and she said she had a miscarriage, but she has waited to see her periods. Her periods are not happening. Her periods are not seen. So we are saying that the first way we are going to answer this question is, first of all, to identify that if at all you've had a miscarriage, let's say you've had a miscarriage today, and then after 1 or 2 months or after 2 to 3 weeks, you are still spotting, you are still bleeding. This could mean that you could be having an issue with what we call RPOC. RPOC simply means you could be having retained products of conception. You could be having an issue with retained products of conception. Retained products of conception, we mean the pregnancy could have come out, but when there's still remaining pregnancy tissue in your womb. How can you tell that you have retained products of conception? Because you might have had a miscarriage 3 weeks back, but you are still bleeding. The only way to identify that you could be having retained products of conception, you are still having the blood coming out. The only way to identify is by doing what we call a pelvic ultrasound scan. A pelvic ultrasound scan, we've talked about it before. It is a test whereby images will be taken of your reproductive system. These are the ovaries, fallopian tubes, and then your womb. The pelvic ultrasound scan will show how your womb is. If there are retained products of conception, your inside, the endometrial stripe, will not actually be visible. Your doctor will not be able to see this inner lining known as the endometrial stripe. What will be seen on a pelvic ultrasound scan to confirm that you are having retained products of conception will be lots of contents. We call them echogenic contents. You'll see that on your report. If you do your ultrasound scan and the report comes out and it shows that you have lots of contents inside with a volume of maybe 10 mils, 50 mils, or 100 mils. I've worked on clients who have volumes of 200 mils, lots of echogenic contents. They think that probably the pregnancy actually came out fully, but when they are still having lots of contents, lots of pregnancy tissue and mixed with blood. So when you have had a miscarriage today and then after 2 to 3 weeks or after 1 month you've had a miscarriage and you are still bleeding, please urgently go and do a pelvic ultrasound scan. Do it from a reputable place whereby you will get real results. And once these contents have been identified that you are having these, then your doctor will suggest possible alternative, or your doctor will suggest possible medical treatments for you. Your doctor may decide to give you drugs to help expel these contents if at all the volume is low. Or your doctor could actually opt for your doctor will actually advise for removal through a special procedure known as a D&C. D&C simply means dilatation and curettage. It's a procedure which is done in theater whereby these contents will be removed manually, and normally it's a painful procedure, but you need to prepare yourself psychologically for this. And yes, your doctor will take you through all the counseling preoperatively, that is before you go to theater. Your doctors and the nurses, the attending nurses, they will help educate you on what will be done in the theater, and then of course you are supposed to sign the consent form allowing that this procedure gets done. And after this procedure has been done by your doctors, remember this is a procedure which is advisable. You should not refuse to do the procedure, because what happens is that if you are having these contents in your womb and then they are not removed, you are most likely going to go into what we call sepsis. Sepsis is when these contents, remember, they are mixed with blood. They may actually begin rotting. And then when they do rot, what the end results are going to be, this infection is going to filter into your bloodstream because your uterus is supplied with blood vessels. So these rotting substances or these clots can easily go into your bloodstream, and then they may actually travel to your heart, and what may result may not be good. You may go into actually shock. You may go into what we call septic shock, whereby the results will not be good. So remember to have these contents removed either through tablets if at all the volume is very low. There are drugs which can be given. This video is for education purposes only. We shall not mention all those different types of drugs. But there are special drugs which can be given. They can force your womb to expel these contents manually. Normally, you will experience pain. Remember, the pain is as a result of the contractions happening, and specifically, it may actually be similar to the contractions you get when you are giving birth. But remember to be strong, have this removed, and then give yourself a waiting time of at least 3 months. After these 3 months, you can still get pregnant again. But I always advise my clients to use these 3 months as a time of healing, as a time of identifying what was the cause of the miscarriage in the first place. So we've talked about the miscarriage, we've talked about what could be the causes of bleeding after the miscarriage. We are going to answer the question that was asked by one of our viewers, and she said that she has not been able to see her periods after 2 months of having the miscarriage. She had the miscarriage and then 2 months passed, but she is not able to see her periods again. So we are answering this question. Remember, you are on Gerard Massa, the healtheducator.com, the best fertility pregnancy channel. So ask me all your questions in the comments. I really love to answer all your questions. Ask me anything about pregnancy, about fertility, about how you can get pregnant faster, and I will answer. I will give you my best advice on how you can get pregnant faster. So we are saying that when you are not able to see your periods after 2 months of having had a miscarriage, then the cause could be that there's an imbalance in your hormones. But before we answer this question, we need to identify, or we need to understand that normally when a miscarriage has happened, there's always a cause. When a miscarriage happens, there's always a cause. To see your periods, to get pregnant again after having a miscarriage today, the most important thing is identify the cause. So to wrap up the whole thing, to answer this question that was asked by our subscribers, she's not able to see her periods. The answer is identify the cause of the miscarriage in the first place. We say that miscarriages have causes. If the cause of the miscarriage was stress, remember when a woman is pregnant and she's undergoing excessive stress, she's experiencing excessive stress, there are high chances that there's going to be a hormone. It is called cortisol. It is a stress hormone. So when cortisol has been released, there are high chances that it's going to bring about a miscarriage. So if the cause of the miscarriage was stress, address the stress, manage the stress, and then your periods will simply come back, because when you are out of stress, there are high chances that your hormones are going to go back to normal, they are going to balance. If the cause of the miscarriage was infections, probably maybe you had a PID, also known as a pelvic inflammatory disease. If you had a PID, which is actually confirmed, which is confirmed by doing a pelvic ultrasound scan, free fluid will be seen in a part which is known as the pouch of Douglas. Remember, we've said that the pouch of Douglas is the part between your rectum and your uterus. So if there's free fluid collecting in that part, and you were pregnant and you had the PID, then it's very simple. Treat the PID and then your periods will come back to normal, because PID brings about an imbalance in your hormones. And remember, to see your periods normally, your periods have to be normal. I mean, your hormones have to be normal. You have to be going through the 3 phases, that is the follicular phase, when the eggs are growing, the ovulatory phase, when you are ovulating, and then also the luteal phase, when you have just finished ovulation and probably you've got pregnant, then the periods do not happen. They will not appear. If at all you do not get pregnant, then these hormones are going to drop and then you'll see your periods. Ask me all your questions and I will answer them.